Migraine. What is migraine? Migraine is a neurovascular disease caused by neurogenic inflammation and characterized by severe recurring headaches. It is characterized by severe episodic headache in one side of the head associated with photophobia, vomiting, vertigo, visual disturbances, etc. More seen in females than in males. Classification of migraine. First, migraine without aura or the common migraine. It does not give any warning signs before a headache. Second, migraine with aura or classical migraine. It shows warning signs before the onset of headache called as aura, most commonly that is the visual aura. Third, complicated migraine, long and frequent migraine associated with seizures. Fourth, retinal migraine. Headache is associated with blindness of one eye for less than 1 hour. Fifth, basilar migraine. There is occipital headache preceded by vertigo, diplopia, and dysarthria. Also, there can be visual and sensory disturbances. Sixth, ophthalmoplegic migraine. There is transient third cranial nerve palsy. Seventh, hemiplegic migraine. Eighth, vestibular migraine. Ninth, catamenial migraine, that is the migraine associated with menstruation. Clinical features of migraine. Headache is usually hemicranial, throbbing, and associated with nausea and vomiting. First, migraine without aura, also known as common migraine. Headache is associated with photophobia, visual disturbances, vertigo, scalp tenderness. It starts at puberty and comes in episodic attacks. Migraine with aura. Patients with migraine experience malaise, irritability, behavioral change in some hours or days immediately before the headache. Types of aura are first visual aura, second sensory aura, third language aura. First, visual aura. In visual aura, as you can see in this picture, it is associated with visual symptoms such as shimmering, fragmentation of images, and temporary visual field loss. Sensory aura, it consists of positive sensory symptoms such as tingling followed by numbness spreading over 20 to 30 minutes from one part of the body to another part. As you can see in this picture, the tingling followed by numbness starts from the fingers and spreads towards the upside of the body. Language aura. It consists of transient speech disturbance. Phases of migraine. The phases of migraine consists of four phases after which the patient comes back to normal. These phases are first prodrome, second aura, third headache, and fourth resolution. The prodromes consist of cravings, tired and yawning, heightened perceptions, and fluid reception, while in the aura phase there is visual aura, language aura, and sensory aura as explained before. Clinical features of the third, that is the headache, consist of anorexia, nausea, vomiting. The patient is sleepy and yawning. There is also photophobia and osmophobia. The fourth phase, that is the resolution phase, consists of vomiting and the patient goes to deep sleep. Diagnostic criteria for migraine. Migraine can be classified as migraine without aura or migraine with aura with the help of following criteria. For migraine without aura, at least 5 attacks fulfilling the following criteria should be present. First, headache attacks lasting for 4 to 72 hours. Second, headache has at least two of the following four characteristics. First, unilateral location. Second, pulsatile quality. Third, moderate or severe pain intensity. Fourth, aggravation by or causing avoidance of routine physical activity, for example, walking or climbing stairs. During headache, at least one of the following nausea and vomiting or photophobia and phonophobia must be present. For migraine with aura, during the past 3 months, at least two of the following with headache must be present. First, nausea or sickness to stomach. Second, sensitivity to light. And third, limited ability to do work, study, or do what one needed to do for at least one day. Red flags in migraine. The following given are the red flags in migraine. You can pause the video and remember it with the help of the mnemonic given. General measures in treatment of migraine. One should spend time with nature, keep a journal symptoms, drink enough water, eat on a regular schedule, drink less alcohol, have a good sleep habits, reduce screen time, avoid lights, and one should do regular exercises, try hot or cold compressions, and do regular exercises and yoga. Treatment of migraine. In acute attack, first non-specific treatment is given with NSAID and antiemetics. Non-specific treatment, triptans and dihydroergotamine are given. For prophylaxis, anticonvulsant, beta blockers, tricyclic antidepressants and calcium channel blockers are given. Drugs used in the treatment of migraine. Apart from analgesics, NSAIDs and antiemetics, triptans like sumatriptan, rizatriptan, zolmitriptan, and ergot alkaloids like ergotamine and dihydroergotamine are used. To prevent the attacks, propranolol, amitriptyline, valproic acids, gabapentin, etc. are used. Thank you so much for watching this video.